The underlying principle of integrative therapy is the idea that what happens in the mind happens in the body, and what happens in the body happens in the mind. Of course, it's not an original idea. This idea is the foundation of all spiritual and healing traditions of the world. Ancient Egyptians stated, that which is above is below, that which is below is above. Or the Chinese symbol, yin and yang, remember, black within white, white within black. That which is inside is outside, that which is outside is inside. The Hebrew star, one triangle looking up, one triangle looking down, as above, so below. And of course, the father of Western medicine, Hippocrates, 2400 years ago said, I would rather know what sort of a man has a disease than what sort of a disease a man has. He understood that our inner life is as or even more important than our physical symptoms. Modern studies support these discoveries, of course. Let me tell you about one. That's not so modern now. 45 years ago, Dr. Jenkins at the Department of Health Education and Welfare of Massachusetts did a study on factors that increase the risk of getting a heart attack. And at that time, they already knew pretty much that high cholesterol, high blood pressure, certain forms of diabetes, obesity are contributing factors. The study was quite large, with 900 people, I believe, and it was publicized. But the shock came when they discovered that 85% of people in the study, people who had a heart attack, did not have high cholesterol, did not have diabetes, were not obese, did not have high blood pressure. So it was quite a shocking discovery. So they decided to continue the study, and they sent out questionnaires to all these people, asking them about their lifestyle. And what they discovered was that there were no commonalities among those people except one. Only one thing was in common, and all of them, and that was job dissatisfaction. They all hated their jobs. When the study was published, another doctor, Dr. Muller at the National Institute of Health, did a computer search on the distribution of heart attacks on different days of the week. And what he discovered was that more people have heart attacks on one particular day, which is very strange. Dogs, for example, don't know the difference between Thursday and Friday. He discovered that more people have heart attacks on Monday between 7 and 9 in the morning, which literally means I would rather be dead than go to work. That's a very impressive study, which pretty much contradicts to what William Harvey a few hundred years ago described heart as a pump. That's all it was. A heart was a pump that was pumping blood, pushing it through the body. What we are discovering now, and what the ancients said, was that the heart is the seat of our emotions. In fact, the heart is about liking, disliking, loving, hating. And there are other impressive studies connecting heart with this specific emotion. In fact, they discovered that people who lost a spouse have twice as high a risk of getting a heart attack than an average person. Again, it's called heartbreak in good old times, but now, of course, they call it congenital heart failure. The reality is that there is a loss of hope, grief, and that affects the heart. But if the heart is not just a physical organ pumping blood, if the heart is connected with meaning, it cannot be that only the heart has meaning and other organs don't. And what we're discovering in integrative therapy is that all organs are meaningful. And how can it be otherwise? Your eyes have meaning. You see with your eyes. And in my practice, I discovered that people who have difficulties facing or seeing things develop eyesight problem. With age, of course, your eyesight gets a little worse. But if a person begins to have problems at younger age, then for sure there is a connection between eyesight and being able to face something. Digestive system is a perfect example of the mind-body connection. I find that people who have difficulties swallowing something, that is, they face situations, circumstances where it's hard for them to take in information, assaults, confrontations, develop throat problems. People who are forced to swallow, forced to live with something that is presented, let's say a job where you cannot speak up to somebody because it's your boss, and yet you need a job, so you keep swallowing, but you cannot digest. You cannot digest or tolerate what is being done, so a person is developing some stomach problems. People who take in, digested, dealt with information, but have difficulties letting go. That is, they store information, they hold grudge, they have resentments. Then they simply have difficulties eliminating, releasing, letting go of it. Then they develop constipation or some serious colon problems. Every organ has its meaning, so that is a subject for a whole different topic discussion, but the idea is that all organs are meaningful, and in order to heal the organ, we need to address the issue that is encapsulated, that is hidden within the symptom itself.